Well, welcome. I'm Pat Camillo, your Nonna nurse. Today I want to talk with you about something that many nurses experience but don't always have words for. Something that at first doesn't always have a name. It's that feeling when something you're part of or expected to go along with doesn't sit right in your body. It's not stress and it's not burnout. It's a deeper kind of uneasiness. Many times before we're even able to name that feeling, it's felt. Over the years, I've personally come to understand this as a kind of moral ambiguity that can also lead to moral distress. I've experienced this myself, both in clinical settings and in academic nursing. And for a long time, I thought, maybe I wasn't coping well enough, or that I should have done something differently. It took me years to realize that what I was feeling wasn't personal weakness, it was an ethical response. Although moral distress often is identified in clinical settings, that's not the case in academic nursing. And that's what makes this discussion especially important. So rather than talk about this abstractly as a concept, I want to offer 3 hypothetical scenarios. Now, these aren't confessions. They're not even unique stories. They're situations many nurses and educators will certainly recognize. And as you listen, pay attention, just notice what happens in your body. Because that's often where moral ambiguity and distress first show up. Okay, so the first scenario has to do with institutional pressure and the potential impact on patient safety. How many times are you feeling the pressure to upgrade student assignments? Are you sensing that a C has become a B and that a B has somehow morphed into an A now? How many times have you thought, 5 or 10 years ago, this student would have received a failing grade for this assignment? We all know this. It's grade inflation, right? And honestly, it's not just in nursing. It's across the board in many universities and across disciplines. And for many of us, it can leave us with that feeling of uneasiness. Let's look at a specific example. Imagine being part of a decision involving a student who's clearly struggling. It's a situation that makes you worry about safety and competence. So you share your concern with your colleagues and maybe even the dean. You offer the student support, including the option of an incomplete and maybe additional mentoring. But maybe this is rejected. Maybe the student is near graduation and needs to take on a job that's already been offered. Maybe there are significant financial pressures. Or maybe that student has relationships within the community that involve other supportive faculty. Well, suddenly the decision isn't really about safety anymore, is it? Some of it may be about empathy, certainly related to this student's circumstances. And it may even be about keeping things moving. And by that I mean the flow of students in the pipeline. Because most nursing academics are aware that these days there's institutional pressure to enroll and graduate as many students as possible. Ultimately, let's say in this first scenario, a decision is made to pass this student. And of course, nothing catastrophic is going to happen that day or the next. And yet, you may still find yourself very uneasy about it. Perhaps you replay scenarios in your mind involving patient safety. Or maybe you imagine some downstream consequences involving people's lives. And through all this, your body knows that something isn't resolved, even after the student is given a pass for the course. Now, that's the first scenario that I think we're seeing more and more these days due to growing institutional pressures tied to the nursing shortage. The result, however, can lead to moral distress among many faculty. In the second scenario, let's look at integrity in an academic setting. This is another situation that many educators will recognize because it involves the evaluation for promotion and tenure. So in this situation, let's look at two possible examples. In the first example, you're maybe asked to review someone's work who's not met the established criteria for tenure. Maybe you really try to find justification to provide a positive recommendation because you do understand the human stakes here in terms of livelihood, family, and even identity. But sadly, the evidence just isn't there. So you vote against tenure. Now, complicating this situation may be the established relationships this person has with the existing faculty. As a result, maybe a decision is made to override the criteria. But then you are left again with that feeling of uneasiness. In a second example, there may be a candidate for tenure who's met all the criteria, but has not established close relationships with the existing faculty. As a result, this candidate may be considered by the committee to not be a good fit in this particular organizational culture. As a consequence, this person's request for tenure is denied. Being involved in this review, you may have identified these issues, but also felt compelled to acknowledge the worthiness of this application, which did not include the need for personal relationships with the faculty. When this applicant is rejected, you struggle to accept how this action aligns with the established criteria. And that, once again, can create that uneasy feeling. So let's be clear about something. In both these scenarios, the distress here is about being asked to participate in something that quietly erodes trust in the system itself. You would be left holding a question that just doesn't have an easy answer. And that question is, what does integrity mean if the rules only matter sometimes? Now, in the third scenario, we're looking at silence in the face of racism or incivility. This third scenario is one that many people hesitate to name at all. But let's do it. Let's say you witness a comment or an action that's clearly racist, or maybe it's demeaning, or perhaps exclusionary. It could happen very quickly, maybe in the hallway, over lunch, or perhaps even during a meeting. In that moment, your body reacts. You feel your pulse a little bit more. Your muscles are getting a little tighter, but you say nothing. Later, you think about what happened and what you should have said. And you also, though, consider what it might cost you if you were to say it the next time in a similar situation. Responding in that moment usually never happens. But what lingers is the weight you feel having to navigate risk in a space that claims to value equity. Now, what connects these three scenarios is not failure, and it's not even lack of courage. It's moral ambiguity. It's the experience of being caught between competing values with no clear, safe path forward. When that ambiguity goes unrecognized, unsupported, or even silenced, it doesn't disappear. It accumulates. And over time, that becomes what we call moral distress. Now, many nurses may tell themselves, I should be over this by now. Or they might even think, others seem fine, what's wrong with me? But moral distress is not something that you just get over. It's something that needs to be named, witnessed, and reflected on. Often just realizing that this is ethical, not personal, can bring a measure of relief. So this was just a brief look at how moral distress, often preceded by moral ambiguity, can show up in academic nursing. There are practical strategies that can be implemented to help prevent these situations and also address them when they arise. I'd be glad to share more about these in a future video if you think that would be helpful. I also hold small, confidential Zoom conversations for nurses and educators who want a protected space to reflect on these kinds of situations. Not to fix them, but to think them through together. Because where there's nowhere safe to talk about these experiences, they can slowly and quietly affect the quality of your life. If this is something you're navigating, you can find more information and additional writing on this topic below. And if something resonated here for you, please feel free to share your thoughts as well below. Your Nonna nurse is here, and we can think it through together.